Hi, everyone. Thank you so much for attending today's webinar. We are so excited to have Sharon Mascarenhas with us. She's going to be presenting on Healthcare Simulation 360, a case from the United Arab Emirates. I am Caitlin. I'm a member of the IPSS executive staff, and I will be moderating today's webinar for Sharon. For those that are attending and are not members of IPSS, please join the society. You have access to a lot of exclusive member benefits, including accessing this recorded webinar after the fact. It will be on our website, and you'll be able to view the handout as well as the recorded presentation. So definitely make sure to check out our website to see all of our membership benefits. Just a couple of quick housekeeping notes before Sharon gets started. All questions are going to be held till the end of the presentation. You'll be able to type in your questions in the control panel that is located most likely at the top right hand of your screen. You can type your questions in there, any comments you have, and we will hold all those to the end, and I will read them aloud for Sharon to answer. We'll reserve about 10 to 15 minutes at the end for Q&A. You are muted throughout this entire presentation, so just note that there will not be an interactive session. As I mentioned, Sharon is going to be discussing Healthcare Simulation 360, a case from UAE. Like I said, the session will conclude with an open question and answer period as well. Just a little information about Sharon. She is a qualified educator with over 12 years of experience in healthcare education. Specifically for the last 5 years, she's been involved in design, delivery, and evaluation of simulation-based education for healthcare professionals with special interest in patient safety, human factors, and community engagement. She's currently serves as a simulation educator, and she is also pursuing her fellowship with IPSS. And with that, Sharon, I'm going to go ahead and kick it over to you if you would like to get started.
Yes, hi, thank you, Caitlin, for that lovely introduction. Hello, everyone. It's a very pleasant evening in Dubai. I know for some of you, it's like a nice, crisp morning. Thank you very much for taking the time to join the webinar. And as mentioned, the title of my webinar is Healthcare Simulation 360, a case from the United Arab Emirates. The objectives for my session today is I'm going to discuss on the overview. I'm giving an overview on the infrastructure of our simulation center, discuss the healthcare simulation journey of our center, and describe the simulation activities conducted by the center at various capacities. Before I proceed, I have a sort of a disclaimer. I just want to inform everyone that all information provided in this session are first-hand experiences from the simulation center. I would like to acknowledge previous and present simulation team colleagues who were and are involved in this very progressive journey. So location, yes. So for those of you who are not aware, the Khalaf Ahmed Al Habtoor Medical Simulation Center, which is now with the Mohammed bin Rashid University of Medicine and Health Sciences, is situated in Dubai, which is the United Arab Emirates. We are very enviably located at the crossroads of Europe, Asia, and Africa. We boast our unique geographical location, which makes us a melting point of many cultures. It also makes simulation very, very interesting in this area. So why are we different from the rest of the simulation centers? I would say we are one of the few simulation centers that was actually first a standalone simulation center. And then we had the University of Medicine and Health Sciences open up. Most of the sim centers either open up with the hospital or after the hospital with a university or after the university in support of it. But for us, it was a reverse. So the sim center opened up first and the university opened up later on. Our learning spaces. We really have a state-of-the-art simulation center, and our virtual hospital is spread over 3 floors and is around 30,000 square feet. As you can see over here, this is our basement. And in the basement, we have our ambulance where we can simulate real scenarios. We have an ER. ER is divided into major bay and the minor bay. Also with the ER is the radiology room where we have a CT scan, which is a shell CT scan, but can be used for the emergency patients who come in. This ER also has a control room. So the students or the facilitator can sit there and look around, have a 360-degree view of what is going around in the ER. So this is the floor plan of the second floor. The second floor is more of a virtual hospital. If you can see over here, this is the we have a training room, which also can be a holding space. So we enter from here, and as we enter from here, we have 2 ORs. All of our operating rooms have very high fidelity mannequins. If you walk again through the sim center, you will see we have the adult ICU, the pediatric ICU. We have a medical ward space. We have a maternity ward, a maternity suite. We have a consultation room so that we can simulate consultation scenarios as well. And we have 3 debriefing rooms, which can be opened up or closed as and when. You can also walk directly into the male or female changing rooms from the sim center, whether you want to enter from here or exit from here. We also have a dental simulation space right over here next to the training room. So these are some pictures of the floor plan that I just showed you previously. That is the dental simulation suite where we have 13 phantom heads for our postgraduate dental residents to practice on. We have the maternity suite again with a high fidelity mannequin, a resuscitator. We have the intensive care unit divided into adult and pediatric intensive care unit. We have 2 ORs with the opera, one of the OR with an opera setup, and one of the OR has the HPS as well. And we also have a medical ward, which is a 2-bed ward. Again, it has an attached toilet and bathroom just to make it as realistic as possible. Our third floor, which I have not displayed over here, but is a set of multi-purpose rooms. One of the rooms is also is used for clinical skills. So we have various clinical skills in the room, like airway trainers. We have the prop birthing trainer, chest tube, catheterization, etc. We also have tutorial rooms and clinical consultation rooms parallel to one another, so that when we are practicing skills in the clinical consultation room, it can be seen by the members in the parallel room, which are the tutorial rooms, and we have cameras and sound systems fitted in both these rooms. These are also multi-purpose rooms again, which are used for multiple mini interviews and OSCEs as well. We rent them out to other facilities in case they need, and we have huge spaces adjacent to both these rooms, which also can be used as holding areas. They can be used to disseminate lectures. We do have a lot of options. About our simulation center accreditation, we are the only accredited center for the Society for Simulation in Healthcare in the United Arab Emirates. We are also accredited by the American College of Surgeons for surgical simulation, and we are also an international training center with the American Heart Association. Here are a few examples of the sim modalities that we use. As I said, we have various part and complex task trainers. We also have an extensive bank of simulated patients, which I will be talking about later. We also have human patient simulators. We have 19 medium and high fidelity human patient simulators ranging from newborn to adult. We have the full range of it. And a couple of screen-based simulation with haptics. That's basically for the surgical sim and kinesthetic skills. This is our current team at MBRU. That's myself, the first person. And next to me is Jolly. Jolly is a lecturer with the College of Nursing and Midwifery, and she helps with the simulation as well. Then we have Professor Nabil Zari. Professor Nabil Zari is the director of the IEHP, the Institute of Education and Health Profession. Next is Safija. She is our admin staff. She does a lot of liaising and works with the admin. Then is Meghna. Meghna is also a sim educator like myself. And then we have Jalal, who is the sim tech. So currently we belong to the Institute of Health Professions, Institute of Health Professions Education. So the mission of our SIM Center is basically to support the educational function of health professions colleges of the university and to serve as an international hub of a network of local and global scholars committed to studying, testing, and improving education. Besides that, we also see it providing sim-based learning opportunities to the community at large and also innovate in the use of simulation for health professionals. We are looking at, along with upskilling, we are also looking to provide excellence to organizations all around and also transfer this excellence to the community. How are we impacting the training of healthcare professions? Well, we have the undergraduate MBBS program, the postgraduate dental medicine program. We have an upcoming College of Nursing and Midwifery in September 2020. And we also have non-MBRU undergraduate and postgraduate programs which we contribute to. Simulation has been spiraled into the curriculums of all these programs. And we are a service provider as well as a quality assurance body when it comes to the design, delivery, and evaluation of simulation in these various programs. So in the undergraduate medical curriculum, I've just put it down here so that you have an idea of the simulation component in each year. So right now we have 6 years of the MBBS program. So in year 1, we have something called the Introduction to the Practice of Medicine, where we use simulation for a few of basic communication skills and introduction to patient safety. Then we have principles of bioethics, where the students are exposed to various scenarios using SPs we have it over 2 to 3 weeks so that each student has an exposure to the scenario, to at least one scenario over the weeks of bioethics. Then we have principles and therapeutics of pharmacology, where currently we are looking at whether simulation is a better option than a lecture, whether they can remember more if it is a simulation component rather than just a lecture or a tutorial component. In year 2, we again have the Foundations of Clinical Medicine 1, which is one of the many series of clinical medicine. Then we have general microbiology, where we use simulation in 2 parts to teach them skills of infection prevention and control. And then we have a putting it all together session where we expose them to scenarios which embed these skills, and we give the students checklists to see whether these skills are used and also done appropriately as practiced in the previous sessions. This is just a snapshot here of the patient journey in a virtual hospital, which is the first interaction of the students to the virtual hospital at the simulation environment, where they are taken through a patient journey right from the ambulance to the wards to the OR environment, showing the patient journey in most of the hospitals. In the undergraduate medical curriculum, again, we have year 3 and year 4. And as I said, we continue with Foundations of Clinical Medicine 3 and 4, again, which are basically systems. And we contribute by physical examination, we contribute by part task trainer skills, we contribute by simulation on history taking, and then we have the put it all together session, especially for clinical medicine 3 and 4, where they think beyond, where the students have to go to thinking what are the tests that are required for these conditions, what is the alternative diagnosis that you would probably give, how would you counsel these patients. If all these elements are practiced using simulation. We also add a little bit of mind and body, which is mental health simulation. In year 4, it's a lot of clinical procedural skills. As you can see here, it's myself and some of my teammates. We are trying to prime the IV arms, and we had a small disaster. So besides MBRU, we also have non-MBRU undergraduate medical simulation sessions. So this is another sister university, the Dubai Medical College. So they come to us in their year 4 for these 3 areas, that is internal medicine, pediatric simulation, and obstetrics and gynecological sim. So over 6 weeks, they get their students here in small batches of 8 to 12 and expose them to certain scenarios with objectives. And they come with subject matter experts, but right from conducting the sim, arranging, or I would say being the simulated patient, teaching them the task skill, providing an evaluation, helping them with the checklist, quality assurance of the full of the session, we are very much involved as a center. We are involved, an educator as well as simulation technologist is on board during all these sessions. For the postgraduate curriculum, we have a postgraduate dental resident program, and we have 5 specialties. So simulation it works mainly with the pediatric specialty, where a lot of clinical skills as well as 2 or 3 simulation sessions are had for the year 1 students. And all across, we conducted a communication skills session for all the 5 specialties. Each specialties they have year 1, year 2, and 3. And so we did a communication skills session all across because there was a gray area that needed to be sorted. And we identified 3 specific communication skills which we had to address. And we conducted simulations on that specific to the specialty, that is whether it's periodontics, oral surgery, pediatrics, endodontics. It was very specific to and very niche to the group that we were delivering it to. The upcoming College of Nursing and Midwifery, which is in September, very exciting phase. So it's again a postgraduate program in cardiovascular and pediatric nursing. We are going to have 2 parallel specialties. And we are still in the planning phase. So we are going to use a lot of simulation for this, and I'm personally looking forward to it. We also have partnerships with the other hospitals. We have Al Jalila Children's Hospital, which is the only children's hospital here in the United Arab Emirates. It's specialized only for children's treatment. It's relatively new, state of the art, and very, very beautiful. Yes. So they have an Al Jalila pediatric residency program where every year they take in pediatric residents. We help them a lot with their clinical skills as well, and simulation sessions. We also have the Mediclinic City Hospital. Recently, they opened their PICU again after a 1-year gap. And before they opened the PICU, they had their whole staff come over here with the neonatologist and the head of PICU, and she had her staff run through all the procedures, all the near-miss events that they've experienced before, just so that they can be abreast with what is coming to them, you know, because for almost a year they have had absolutely they didn't touch base with a PICU environment. So they used our sim center for that. And that was a very, very interesting project. Assessment and multiple mini interviews. For those of you who are not very clear about what multiple mini interviews are, they are part of the assessment process for new students. So whenever the students register for our courses, any of our courses, besides their grades, they also have to go through the multiple mini interviews, which are situations, and they are observed as on how they react to these situations. It might not be a medical situation, it would be probably more ethical, and we just want to see like what would the student do in that scenario. So we play a main part in it, especially through our simulated patients. Also the quality assurance, we work very closely with the team, with the admissions team for this process. OSCEs, we work with the course coordinators, especially for the Foundations of Clinical Medicine 1, 2, and 3, and 4, right from setting up how many stations, the dates, the timings, what will be the stations, the quality assurance of the stations, training of the SPs. So we are very much involved in the OSCEs as well. So this happens for medical students, dental residents, as well as the Al Jalila residency program. And it's the same with multiple mini interviews. Coming to impacting the practice of working healthcare professionals. So as I said, the College of Medicine started very late on. Yeah, they started in 2016, whereas this center has been up and running from 2012. So what were we doing? Yes, so we used to create courses, courses like these. I just have a few of them listed down, and these are the ones that I created, I designed, and I conducted basically. So we used to create simulation-based training programs on assessment and management of life-threatening emergencies in schools. This was a program for school nurses exclusively. Essential for infection prevention and control for healthcare professionals. This was for all, again, healthcare professionals who were interested in essentials, and this was during the Ebola time. So it was very interesting. There was the Ebola pandemic, and everyone was coming and rushing and saying, okay, so what are the guidelines? How do we practice them? Many of them didn't even know what a suit, Ebola suit looked like, you know, the infection prevention suit. So we had all of that. We would make them wear it so that they actually knew the difficulties they faced, you know, while even donning that type of a suit. Then we have the communication and interpersonal skills for healthcare professionals, and basic clinical skills and update, which again basically address the healthcare professionals with a skill decay in selected clinical skills. And we had a very good response for all these courses, and yeah. Impacting the practice of working healthcare professionals. So attached to the university is also a dental hospital, of course, for the residents. And we had a simulation session on hand hygiene and use of personal protective equipment for the staff at the Dubai Dental Hospital. So you can see here snapshots of their hand hygiene procedure, and we had a simulated procedure here, and we were observing them whether they did don and doff properly, use the proper equipment that was needed, use the bins, how they wash their hands, whether they followed the 5 moments of hand hygiene. So this again was a very interesting session. If you see the numbers streamed to the center, I have put down our annual numbers for the last 4 years. And we have only increased every year. And the latest is the annual year. For us, it starts in September. So it's September to August. So that so last year, September 18 to August 2019, we trained over 6,000 participants. Over 6,000 participants walked through our center for simulation-based learning or simulation-based education. Besides that, we also conduct faculty development. Faculty development, this is our team internally, and this was a session on difficult debriefing. So every time we challenge ourselves, we see how we can upskill ourselves and stay abreast with the latest in debriefing and simulation strategies. Besides internal faculty development, we also reach out to the university faculty and train them as well in feedback strategies, debriefing strategies, how to design, how to deliver, and how to debrief as well. We have a few projects coming up again where we are not only focusing on stuff within the center, but out of the center on a broader range that is within the UAE, and that will be out shortly. So this is another star project of the Simulation Center, which is the Teddy Bear Hospital. So the first was started in 2017, and we've taken numerous children through this project. So it's basically, it has 2 objectives. We introduce children to healthcare environments, and we try and elevate their fears of hospitals, of healthcare professionals. So the simulation team is wholly involved in this, along with the students. We have volunteers from throughout MBRU, plus the medical college, the dental college as well. We also have another project, which is initially was known as the Year 11 and 12 Schools program. After that, it changed to Destination Medicine at MBRU. We also have a parallel project known as Pulse. So here we inspire high school students to become healthcare professionals. So we invite them to the Sim Center, and we have 2 very realistic scenarios with them, one in the OR and one in the medical ward, where they actually can interact with our high fidelity mannequins and know what simulation-based learning is all about. They also get a flavor of what health professions is and what they need to go through, what the education of a healthcare professional looks like. So this is also a very nice project that is still ongoing. About our simulated patients, so engaging our citizens in the training of future healthcare professionals. We have a bank of 100 plus simulated patients. Yes, they are all 18 years and above, because we don't have any children as of yet as simulation patients, and they belong to various nationalities. If I'm not mistaken, yes, over 21 different nationalities and varying age groups. So it's a very successful program. It is led by my colleague Meghna, and it's going on very, very well. It's a very robust and interactive program. We have 3 levels of training for simulated patients. One is a very basic level, which is level 1. It's welcome to everyone, all aspiring simulated patients. We see if they tick the box, and then they go to level 2. Level 2 is a little specialized training where we train them how to give feedback, which has, sometimes some of them are very raw. They're not exposed to this before and they don't know how to do it. So we see that they can articulate themselves well and give the appropriate feedback for the medical students. And level 3 is the training is if they are used in any high stake exams or if they are used in any assessments, then they have to go through the level 3 training before they are used as simulated patients for the assessments. And they are taught to rate as well, because some of the stations we only have simulated patients giving a score and we don't have any other assessor in the room because they give the patient perspective. So this is our journey in short. You can see, so 2012 is when KHMSC opens. 2014, we had the first school program. We had initiated the SP program. We had the first SIM conference. We also were registered American Heart Association and International Training Center. And we also were an alert course training center. So 2015 is when we had the second SIM conference. 2016 is when we had our first MMI, that means the first cohort for the MBBS. And we also had the third simulation conference in the UAE region. In 2017, we had our first teddy bear hospital. We did the MEDEX DXP, which was a medical education conference with a sim component to it. So it had a parallel simulation component as well. In 2018, we were accredited by the Society for Simulation in Healthcare. In 2019, we were accredited by the American College of Surgeons. So the way forward, we are doing all we can in the capacity that we can. And I think to improvise, we are looking at immersive learning to provide simulation-based experience, and novel simulation ideas. We are looking at certain software, we are looking at certain hardware where we can actually bring in immersive learning to our participants. We're also looking at taking simulation to the community. So right now it's very much within the walls of MBRU that we do it, and also with partners. So we invite everyone here to MBRU. But what we look at is we look at going out to the community and delivering simulation there, and we also look at taking a larger responsibility to support other centers to training of their medical simulation experts and professionals. So we are very robustly looking into this component, and there's a lot of exciting stuff happening as we speak. And yes, place Dubai as the global hub for medical simulation. That's the ultimate aim. So if you want to know more about the center, besides asking me questions towards the end, you can also go to this website. So that's our MBRU website. I can also share my contact details with you if you want to collaborate. I would also be very interested in hearing what can we do more as a center which is attached to our educational institute, and it would be great to hear ideas, collaborate on those ideas. And yeah, thank you very much for listening.
Thanks, Sharon. Thank you so much for your presentation and taking time to go through all of this. For those that are on the line and have any questions or comments or discussion topics, please feel free to add them in the question section or the chat section. And we can take a few minutes to review those while you're still on the line. So we'll just give it a couple of seconds, Sharon.
Yes.
One other thing, Sharon, I was thinking is what we can do is definitely add your contact information into the email that goes out to the attendees that were on the line. And if they have any questions or discussion points that they'd like to send you after the fact, they could do that as well.
Yeah, sure.
Okay, perfect. Right. Well, if no one has any questions, I think we are going to go ahead and end the webinar. Like I said, it will be recorded and posted on our members only website, so everybody will have access to it after the fact, as well as Sharon's presentation, which will be included alongside the recording. Thank you so much to all of those that jumped on today. I know it's kind of a crazy time throughout the world, so we appreciate you taking the time to join us and continue to work on these things. So thanks to everybody. You'll receive a survey as well after the fact that will be auto-generated from the system, so please take a couple of moments to respond to that. And for those who maybe didn't see the notification, just a reminder, IPSS W 2020 has now been rescheduled for October 23rd to the 26th. If you've already registered, your registration will maintain the same, but we hope to see everybody there. And thanks again, Sharon.
Thanks, Caitlin. It was great. Yeah.
All right.
Thank you.
Goodbye, everybody.